Hello and welcome to Doc Talk, the educational and informational conversation series. I'm your host, Jayashree Mani, clinical nutritionist at Perk Integrative Health, and it gives me great pleasure in welcoming our guest for today, none other than Dr. Joel Kahn, a holistic cardiologist and well known as America's healthy heart doc. It's really hard for me to imagine, but for those who don't know about Dr. Kahn, he's also triple board certified in internal medicine, cardiovascular medicine, and interventional cardiology. Also the first physician in the world to be actually certified in metabolic cardiology with A4M, MMI, and the University of South Florida. And he runs the famous Kahn Center for Cardiac Longevity in suburban Detroit. And with numerous publications, including 5 books, Dr. Kahn has appeared in multiple shows, including Dr. Oz, Dr. Phil, and Larry King now. So it gives me great pleasure again in welcoming Dr. Kahn, Doc Talk series. Welcome, Dr. Kahn. Thank you for joining us.
Thank you. And don't forget, I'm a graduate of the famous Perk Academy. So that please, because that was a great, great source of education and information. Thank you.
Oh, thank you. And thank you for, being such an integral part of our third session that we had this year. So it was very informational as well. So I am going to start today's discussion or our conversation going back to kind of the beginnings and asking you, what is a holistic cardiologist?
Yeah, and there's not a Merriam-Webster dictionary definition, but there's a couple passes at it. I practice what I would call standard, and I guess that's not holistic cardiology for more than 2 decades. And the emphasis is on meaningful but brief history, physical lab assessment, pretty standard template lab assessment, testing procedures, pharmaceutical drugs. And it does a lot of good for people. If your blood pressure is 220, you might benefit from a pharmaceutical drug, like happened in my office yesterday afternoon. But what it doesn't allow, teach, or permit is a deep dive into really the root causes. And that'd be a good term too, root cause cardiology. Diet, stress, sleep, toxicity, chronic infection, known or unknown, dental health, joy in life, techniques to manage stress in life. None of us have a stress-free life, and really getting a bigger picture. Now it's going to take a little more time to get that database. Then it's going to be a little more extensive lab evaluation. And then, the tools aren't just pharmaceutical and procedures. I mean, the tools may be, breathing techniques, meditative techniques, yoga techniques, acupuncture, certainly diet with an alkaline way orientation for sure. Better sleep. I probably spend as much time on sleep with my patients as I do on fitness, for example, although we probably recognize fitness higher on the list of traditional cardiac preventive approaches. But when you're tired, you're not going to the gym. So sleep comes first, actually, in my practice. Absolutely. And even relationships, a lot on sexual health, which reflects on just joy and overall well-being. So it makes the job frankly tougher. I have 1,000 data points rather than 100 data points on a patient, but it's also joyful and meaningful and more likely to really reverse the underlying problem.
Right. So it's like as though you're a psychiatrist and you're, an endocrinologist and you're all these specialists rolled into one and looking at the body as a whole, kind of.
Right. Well, I will certainly refer out areas that need attention that are outside my wheelhouse. But you're right. It's that idea, some people call it systems biology or the network. What's good for the heart is good for the brain, is good for the gut, is usually good for emotions, the mood. And pick other organ systems, So it is frequent and certainly gratifying to see people identify other benefits, even though my focus is largely on cardiovascular disease, heart disease, high blood pressure, congestive heart failure. Everything else will perk up too.
That's true. So now one of the things that you mentioned, of course, in this whole, round way of looking at things is the diet. And you're a big advocate of a plant-based diet. now, do you have any animal protein at all, or do you advocate a completely vegan diet?
So, I mean, I personally have been following an all plant, no animal food diet in my own life, my wife's life, for about 45 years. I started at age 18. And it's worked out well. Pretty healthy person, pretty healthy labs, no pharmaceuticals, no operations, no hospitalizations. I wish everybody the same health. I feel good every day, energetic, with feeding myself with very alkaline-rich foods from the content of plants and plant juices and the rest. Does it work for everybody? I teach my patients that that's the ultimate goal, particularly in cardiac disease, because our database to prevent and reverse established heart disease like plaque, like blockages, is really limited to largely or completely plant-based diets. The pioneer research of Nathan Pritikin and Dean Ornish and Dr. Esselstyn and Dr. Joel Furman and some others. But I'm not cracking a whip with them. If I can get them, if it's a crisis, we may have to move quick. If they're facing bypass surgery and they really want to work to avoid, we're not going to take 8 weeks to change the diet. We're going to start today. And I'm going to give them a meal plan and some educational material like watching Forks Over Knives or What the Health or Game Changers movie on YouTube or Netflix, simple little ways, read a book I wrote called Plant-Based Solution, or
there you go.
Dr. Ornish's book, Undo It, or Dr. Esselstyn's book, Prevent and Reverse Heart Disease. But the majority of people, I'm going to be pretty simple. Can we get rid of the eggs and bacon? Or can we get rid of the Speedway sandwich at the gas station on the way to work and get a bowl of oatmeal, or learn to make a smoothie, or have a salad for breakfast like they often do in Europe and Israel and the Middle East? You know, can we take one meal and upgrade it? Can we eat one apple a day, get some more fiber and improve your microbiome and get some more alkaline food in you rather than acidifying food like meats? Can we, it's for some people, one meal is, can I get you to put lettuce and tomato on your turkey sandwich? I'll start with that if we're really coming from, the deep standard American diet, and, keep on going. But ultimately, I often pattern what I do after both Dr. Jaffe's Alkaline Way book and also Dr. Walter Longo, premier nutrition scientist in Los Angeles and Milan, where he advocates about 18, 19 meals a week if you eat 3 meals a day that are whole food plant-based, beans and peas and lentils and fruits and vegetables and whole grains, and 2 or 3 servings of fish a week. Now, I choose not to follow that in terms of 2 or 3 servings of oily fish a week for omega-3 content. I get my omega-3 from other sources, chia, flax, hemp, maybe some algal products. But Dr. Longo's no lightweight, Dr. Jaffe's no lightweight. So it should be largely brightly colored fruit and vegetables,
rainbow,
and whole grains, like 100% whole wheat breads and quinoa and millet. Interesting little article about millet today in the news that promoted its health benefits. I got to start eating some more millet.
Millet's amazing. Yeah, it also suits the gluten-free population. The folks who have to avoid that, and on other things like food sensitivities and such. So, I mean, you're practicing actually personalized medicine. For each individual, it's different. You start at a different level. And that's where these sensitivities can also play a role. And I guess
long term, they have to trust me a bit. And if I impose on them what you have to do on a first visit, which sometimes is necessary if their health is at risk, I've got to lay the law down if their blood pressure is 220. But for most people, I got to get some trust, some buy-in, and I got to educate them some, because the medical community needs education, and certainly the average person in the community needs to do a little bit more legwork on, the food is medicine connection, the food is gut health connection.
Exactly.
And, the food is the alkaline way connection for sure.
Absolutely, absolutely. So I think the focus of lower animal protein also just tends to fit in with the risk that this compound called TMAO poses. What are your thoughts on that?
Yeah, I was an early adopter of TMAO, but just to break it down in a minute or two, three researchers at the Cleveland Clinic a decade ago, 2011, asked the important question: there have to be other molecules, other metabolites in the blood that lead to artery damage, atherosclerosis, than just the ones we've known since the 50s and 60s: high blood sugar, high cholesterol, high blood pressure, smoking, toxins, and such. And they did a kind of artificial intelligence search, came up with three possible molecules, and narrowed it down to the one you mentioned, trimethylamine N oxide, a mouthful, but TMAO. They
TMAO.
developed a reliable way to measure it. This was a chemical known in biology, more so in deep water fish, but they were able to start measuring in humans at the Cleveland Clinic. And they showed quickly the more extensive your heart blockage problem, the higher was your blood level of TMAO. And then they went back to the bench to figure out how does it get in the blood. And it's a fascinating story, but largely, nothing's as simple as it seems, but largely a chemical in red meat called L-carnitine and a chemical in egg yolk called choline can be converted by bacteria in the border of our gut with an enzyme called a lyase. And those chemicals become a product in our body called TMA, trimethylamine. And as it goes through the blood, it quickly gets converted by our liver and an enzyme to TMAO. What's the big deal? There's a lot of data that TMAO not only might be a marker for how much heart disease, but it may actually cause the heart disease, just like we think LDL or oxidized LDL cholesterol causes plaque. Some pretty good animal data that TMAO causes blood clotting. TMAO may promote plaque. You don't want a high blood level. In about 2015 or 16, Cleveland Heart Labs, which is now Quest, came out with a blood lab so you could measure it in your patients. And I've probably measured it really 5,000, 6,000 times, a lot. And I like normal levels. And when it's high, I've got to ask what they're eating.
Yep.
It turns out if your vitamins have, you might be a gym rat and you're taking, or a monster drink, first ingredient is L-carnitine. And
I was going to ask you that. Does that pose a problem for those who are taking supplements?
Yeah, choline's in quite a few supplements. It doesn't mean it's always a bad idea, but particularly if you're a heart patient, congestive heart failure, diabetic, I'm going to check your TMAO level, and we may have to rearrange your supplements, rearrange your diet. There is at this point no specific probiotic, no specific prescription drug, of course, to lower TMAO. It's mainly diet. There have been studies that are just adopting a Mediterranean diet, less red meat, less eggs, more produce, maybe some extra virgin olive oil instead of butter, lowers TMAO. And that would be an alkaline diet anyway. So that would be a good place to go if you're not going completely plant-based. Right. But it's been now there's more than 1,000 published articles, all kinds of data from brain disease to heart disease to kidney disease to diabetes. It seems to be quite an important metabolite, and it's the most interesting one of a kind of emerging field, gut-heart connections. I mean, which is obviously cheeseburger, heart disease is a pretty clear gut-heart connection. But when we can really break it down and understand the metabolism, of which most of that has been on cholesterol and blood sugar. So now we got TMAO there. We got something called endotoxins that we talk about after poor quality meals in the blood, although we don't measure that very often in clinical medicine.
Sure. So my question is about somebody who's having choline for the benefits it has. Like choline, they're also talking about so much choline that a pregnant woman must have for the baby, and plus, so there's so many benefits of choline and good quality L-carnitine. So would that mean that they would necessarily have to remove that from their supplementation? Would you tweak that?
It's mainly a marker for atherosclerosis and maybe causal. So a pregnant woman who's eating eggs and maybe some red meat, I wouldn't probably check their TMAO level, but I would check their mother's and father's TMAO level, 25 years older, not in a pregnancy situation.
Right.
So I haven't had a reason to do that. I wouldn't suggest it. There are some plant-based sources of choline, but and I eat dried soy nuts as a common snack because it turns out soybeans edamame happen to be quite rich in choline and don't seem to cause the same rise in TMAO that egg yolks do. It may be just because I have a vegan microbiome and my bacteria don't convert my soybean-based choline into TMAO. But I wouldn't worry about it too much in the pregnant gal.
Yeah, it goes back to the gut. So that gut does seem to be, not only, of course, reducing animal protein, but, making sure that the gut actually is that healthy one that you want.
Right. And avoiding really processed foods, avoiding excess sugar, high fructose corn syrup, trying to get glyphosate out of your diet by eating largely, organic food choices when possible, and all the classic modes, no excess alcohol.
So what is the number one test that you would do for somebody? Or if you're thinking that they should be, obviously you're in this practice for so long and you kind of have your ideas and you have your thoughts, you're pretty intuitive about who you need to, who would be actually at risk for cardiac disease. But then what would you do as a test?
Yeah. I mean, we could talk for hours, but I'll just answer with two answers. In the 1960s, we identified things that promote your risk of getting a heart attack, a stroke, or dying early heart disease. Do you smoke? Do you have high blood pressure? Of course, you need a home blood pressure cuff to know if you have high blood pressure. Get a home blood pressure cuff. Do you have diabetes? So you need to know if your blood sugar's up or your hemoglobin A1C is up or other ways. Is your cholesterol up, whether it's a routine panel or a fancy cholesterol panel? And do you have a mom, dad, brother, sister with early heart attack, stroke, early heart death in their 40s and 50s? And those are the big ones that still 50 years later, doctors focus on. And we use these online calculators to tell you, Joe or Barb, you're at higher risk than average over the next 10 years. So we don't really know that person has heart disease. We're just estimating. And so test number one is there's a CT scan. You can walk into any hospital in America that's a medium or large size, and you can ask with a prescription to lie down, go in a CT scanner, hold your breath for 10 seconds and go home. No injection, no needle, simplest, least scary test you'll ever have.
No radiation.
It is a CT scan. It's on par with a mammogram. So it's very, very low. And most people need this once in their life, maybe around age 45. It's the equivalent of mentally, why do people get mammograms, thermograms, colonoscopy, Cologuard when they feel good? Well, we're screening for a relatively common disease we'd like to pick up early. Well, heart disease has way more frequency than breast cancer and colon cancer. They're all important issues. We do nothing to look for heart disease. So in my town, for $75 at the local hospital, less expensive than a family dinner for $4, you can get a heart calcium CT scan. You may have to push hard on your family doctor, your gynecologist, your internist. You shouldn't have to push too hard on your cardiologist, but they still are a little awkward, even though this test is 31 years old. 31 years old.
Not a new test.
Great documentary called The Widowmaker Movie, if you want to learn more. So get a heart calcium CT scan or go online, spend an hour and watch The Widowmaker Movie. It's fascinating. Number two, even though I just listed the most common, we call them risk factors, blood pressure, diabetes, high cholesterol. There is a genetic cholesterol called Lipoprotein-A, Lp(a), Lipoprotein-A. I'm just going to, in a non-promotional way, because it's an awkward word, there's the word Lipoprotein-A. It's a blood test, maybe $35, $40, offered by LabCorp, Quest, your local hospital. That is a cholesterol that some of us produce. And if we produce it, it's genetic. We produce it from birth all through our life. Clogging up our arteries, actually clogging up one of our heart valves, could cause us to die early, have a stroke or heart attack early. It's on no routine blood panel, no routine blood panel. So you may have had your cholesterol checked 30 times for your HDL LDL. But this is inherited in 20 to 25% of people. So maybe 1.4, 1.5 billion people in the United States, 90 to 100 million people, and less than 1% of doctors check a box to measure the blood level. Now, the drawback is if you inherited a very high level, and it's common, there's no prescription drug right now to lower it. There are big companies like Novartis, like Amgen, that are on the hunt. They're excited. we've got a multi-billion-dollar market if we can get a safe drug to lower lipoprotein-A. I wrote the book I just held up, and I have a practice full of people with sky-high levels. And there are ways using diet and exercise and sometimes nutraceuticals like niacin, CoQ10, hormone balancing that bring it down quite a bit. But we need a pharmaceutical agent that's safe and effective. But those would be the two: heart calcium CT scan and one blood test, because it's so common. I mean, there are genetic cholesterol disorders where you eat nothing but broccoli sprouts and your cholesterol is still 350, but those maybe 1 in 250 people.
Right.
Here we're talking about 1 in every 4 people. So find out your lipoprotein-A level. You may be having to teach your family doctor, I know you don't normally order this, can you just add it to my lab slip at my physical?
Okay. But the lipoprotein-A, that would be one of the cases where genetics really plays a role in the whole progression of the cardiac disease, right? Or
it's purely
otherwise...
genetic. That's purely genetic. It's on chromosome 6. Your mom may have given the ability to produce it in the liver, your dad, or both. And if they both did, it'll be even higher in the blood than if just one did. And you can be doing everything right. And you do hear that once in a while. God, Todd was thin and he liked to run and he seemed to eat well. What happened? I hear he's in the hospital with a heart attack. Well, that's what happened to Bob Harper, the Biggest Loser fitness trainer, who in 2017, looking ripped and, in the fitness field, had a massive heart attack, almost died. And he found out he had a sky-high lipoprotein-A. Now, if he found out 2 years before, when he was 50, would he have done something different, gotten on some blood thinner, gotten on some cholesterol medicine or started niacin, ate more fruits and vegetables, although he was a pretty famous fruit and vegetable eater anyways? Well, that's all conjecture. I predict he would have been able to avoid as many other people, but he's just a fairly famous example that I use a lot because it was in the New York Times when he had his heart attack.
Right. Okay. Now, I want to switch tracks a little bit about nitrates and nitrites. So I know that they produce nitric oxide, and plant-based diets will be able to give you that.
Right.
Can you help our listeners distinguish between nitrates and nitrites that are in preserved foods? And how would you kind of, make that distinction?
Right. And I wouldn't expect most people to know, but back in 1998, the Nobel Prize in Medicine was given to 3 researchers who had spent their career working on what causes arteries to relax so that you get good blood flow for healthy hearts, healthy brains, healthy sexual function. And that chemical ultimately was called nitric oxide. And we learned that if you take good care of your body, have good genetics, your arteries actually make a lot of nitric oxide. And right away, that little molecule helps your arteries relax. It's like the arteries themselves are feeding the cell next door a chemical to help them work better. And the main focus was on an amino acid called arginine. And there are many people that choose to supplement with arginine powders. But there's foods like watermelon and pine nuts and a lot of leafy greens that can be rich in arginine. About 15 years ago, a second pathway you mentioned called the nitrate pathway was identified, another way to make more nitric oxide. You're taking good care of yourself, you're eating watermelon and pine nuts, but you want to make more nitric oxide. So it turns out we have bacteria on our tongue. They're anaerobic bacteria. And if you choose certain foods, and it's largely leafy greens, very alkaline favorite foods, love arugula, maybe the best, could be beets. Beets do a good job. As you chew them, the nitrite in the food will be converted to a nitrate. And as you swallow it, it'll eventually be absorbed. And it will be converted in the blood by an enzyme, if I remember, called XO, to nitric oxide. So now we have a second way. It's an oral food-based pathway to get more nitric oxide. If you use Listerine or Scope, you may kill those bacteria in your mouth, on your tongue, and you may make less nitric oxide. There are studies that show people that use antibiotic mouthwashes don't get a blood pressure drop when they eat leafy greens and beets. They may get other benefits from leafy greens and beets, like the fiber and the alkaline tide, but they don't get the blood pressure drop. And there may even be a little more risk of diabetes if you use some of these antibacterial, antiseptic mouthwashes. Just a funny little tidbit, but it's actually in the medical science. So it seems that for some reason, bacon, pepperoni may have nitrates in them. But when they're surrounded by animal fats, they don't cause this conversion into nitric oxide. So it is only these healthy plant-based foods that
natural
choose them. And that's why you do see athletes frequently talk about beet powders. But if you do that because you want to make more nitric oxide, perhaps to help blood flow while you're biking or swimming, you actually want to let it spend a little time in your mouth. If you just chug down a beet juice, you're going to get a real nutritious food source, but you may skip the pathway. And just to finish this up, even if you do that, you got a organic beet juice and you down it and you're going biking, there's a recycling pathway, and the nitrates end up in your parotid gland through your digestive system, your blood system, and they're actually secreted in your saliva, and they end up back on your tongue. A little less efficient, but if you're not into chewing your food 20, 30 times every mouthful, which is a good idea and very mindful, there's this amazing cycle that might still allow those healthy alkaline favoring foods, even if you're just swallowing them down, they may still get sprinkled on your tongue to interact with those bacteria and go from nitrite to nitrate. It's amazing.
It's amazing. That is so cool.
Right, exactly.
So cool. Well, I know that vitamin C also is supposed to, help in that nitric oxide. So if that's kind of in your supplement line, workup, then I guess that should also help then.
Right. And I use a lot of vitamin C rich foods in my practice. Plant-based foods, of course, brightly colored leafy greens and peppers and acerola cherries and acai berry, and
of course
amla. Amla is an interesting Indian gooseberry, very rich in vitamin C.
I'm surprised you mentioned that. Yeah, it is.
Right? We use a lot of amla. Actually, amla may lower that lipoprotein-A cholesterol. So I actually encourage my patients with high lipoprotein-A cholesterol to add a little teaspoon of amla to their smoothie. But I'm a student. Less so than Dr. Jaffe, probably, of the work of Linus Pauling, PhD, passed on now. It's getting close to 30 years, I think. But he had a theory about how extra vitamin C and maybe an amino acid called lysine may help us produce more collagen for better skin, but collagen for better arteries. And that may help us prevent some atherosclerosis. So as we know, the C flush and ways that you guys teach to really test how much vitamin C supplemental you need. Get it in food, but you want to bring yourself up, particularly if you're fighting blood pressure or you're told you get that heart calcium CT scan, you find out you have some silent plaque. One pathway to deal with it, or you have an elevated lipoprotein-A, one way to deal with it is more vitamin C to the point of tolerance. And that tolerance is usually your GI tract predominantly.
That's right. So any words for children? Because, right now, in these days, we see a lot of childhood obesity. We are seeing a lot more of that. There's diabetes hitting really closer to that young age than it used to be thought earlier. So do you see any children? Do you have any advice for them?
It's common sense, but it's also now science sense that good habits earlier in life are even more powerful than good habits later in life. And good genetics are the best of all. There's some studies, I've been included in them, called Mendelian randomization. But what if you inherit a couple little gene sites that keep your cholesterol 30 points lower than somebody else in your family? And these kind of studies have been done. You have a dramatic, because it's starting at birth. You're 1 year old and your cholesterol is a little lower than your cousin, and you're 12 years old, little on a genetic basis, has a profound impact on your risk of heart disease and stroke when you're an adult. Just as an example, that starting early matters. Now that's kind of a shortcut because it's on a genetic basis. But we also know that it matters what you like to eat. I just recorded a little interview on a series of studies called the CARDIA, CARDIA study. And it's about 5,000 men and women in urban centers in the United States, starting in the 1980s, about 5,000, between the ages of 18 and 30. So we don't usually study and research heart disease at age 18 and 30. And now we've been able to follow these initially young people up for about 3 decades. And there's been a lot of data that plant forward, plant strong, plant predominant diets in that 18 to 30 age were very protective for healthier heart arteries, because they did do those coronary artery calcium CT scans on them when they were 45. Better kidney function, and that's very important, particularly in the African American community with hypertension, where kidney disease can be really a huge problem. So those, a salad when you're a teenager is, predictive of your health when you're 45, 50, and also brain health and actually survival overall. So yeah, it's so important to avoid obesity and the subsequent, metabolic syndromes that become serious disease in your 30s, 40s, 50s as an adult by introducing healthy lifestyle, fitness, sleep, no smoking, and alkaline diets when you're a kid. It's not a cheeseburger and French fries just because you're screaming in the back of the car, though we've all struggled with kids that sometimes food is negotiation. I'll give you a cookie if you'll just give your homework.
No, kids are great. If you give them the right things to do, they will just suck all that information up, and they will just do what you tell them. So I agree with you. Start young.
Yeah. I had a patient in the office yesterday, probably 55 years old. I don't eat vegetables. Why don't you eat vegetables? I was traumatized as a kid about vegetables. My mother used to chase me around the house with a carrot. Oh. I was serious. I said, man, we need a carrot psychologist here to
oh, absolutely. Yeah, no.
Work through your carrot trauma.
Oh, thank you, Dr. Kahn. This has been very enjoyable. Any last words before we sign off? Anything for our listeners?
It's all about mindfulness and gratitude. And I really mean that without being too, new age. But, your health can turn on a dime. I mean, obviously a lightning strike, a car accident, a drowning event on a vacation. But I'm just talking, today you assume you're healthy, and tomorrow you're in an emergency room with a heart attack or a stroke. Almost every case of these can be identified early and worked on early. What I enjoy the most, just to tie it all together, I love when I have adult patients who bring in their 18-year-old children and say, you know what, that blood panel you ran on me, my vitamins, my genetics was so interesting. And my children might have what I have, let's do a panel. And these kids are on their way to college, no vitamin D. They have a homocysteine level that's sky high because they don't have adequate vitamin B12 and folate. I mean, they have no omega-3, one of my favorite blood tests, because it's so frequently abnormal. And they're really easy fixes using food or, nutraceutical supplements. And some of these kids just feel better and their performance is better. Yeah, when you can correct those metabolic things early in life. And food will do most of it with fitness, but it takes vitamins. I don't fight that. I think they can be so helpful if you've got...
It's what they are, supplements, right? So
supplements and diet, but we all struggle even with the great alkaline whey diet to get every nutrient we need. So that's why we have supplements.
Well, thank you again. Thank you for joining us and giving us your time. And we'll look forward to something else like this again in the future. Take care.
Thank you very much.
Thank you so much.